Hey guys, Chris here again. This is going to be our last one, part 3 of our little videos discussing some of those factors for the development of low back pain. So we were discussing hamstring tightness, a reduction or decrease in our lower back curve, as well as a decrease in our lower back mobility, and in particular, that side bending mobility. So we looked at how a simple thing such as your seated desk position, your work role, might be playing a part in contributing to this discomfort. So you're sitting for a long period of time, the hamstrings become a little tighter, the pelvis is sitting back in that slouch position, so your curve decreases, and then you might have more muscle stiffness because you're trying to stabilize a bit more through that spine, which can then reduce the amount of mobility you've got in that back. So we see this all the time at the clinic. It's a very common presentation, the low back pain, especially with these things like stiffness, decreased hamstring tightness, and something like simply reaching down to touch your toes, you might notice you don't have much range of motion, or you've lost some of that range of motion that you used to have. So that might be that hamstring tightness that we've been talking about. So working alongside the osteos here, like I said in the previous video, I see this stuff a lot. So I usually find in the notes that there's hamstring restriction, or there might be a decrease in mobility of that lumbar spine, and that's some of the things that I will work with and try and decrease some of that muscular tension, get those things moving a bit more flexible again, so we can increase that treatment effect and get you back to yourself a bit quicker, and also help reduce the risk of that back pain occurring. So lots of techniques we can use. I tend to use a lot of soft tissue stuff like the myofascial release, some deep tissue. I even do a little bit of dry needling here. We can do some taping and a lot of stretching mobility stuff. So it works well with the osteopathic management, and I sort of go back and forth, communicate with the guys and see what they think is most appropriate or needed most to try and get you back moving as well as you possibly can, so we can get you back to your normal self. Then we can also provide things like home stretches, home mobility plans, and even advice on ways to change your work posture, things to do throughout the day to try and get yourself up and moving a bit different, or even things that you can change with your activities or your lifestyle, so even your gym activities, to try and increase that mobility through those areas and help decrease that risk of that back pain. So if you're suffering from back pain at the moment, if it's a thing that you have recurring or a regular thing that happens with you, come in and see us at the clinic. It's a very common thing that we deal with, and we've gotten pretty good at being able to help manage it and improve those outcomes. So it was nice to see you guys, and hopefully I'll see you around the clinic soon.